Okay, well, I appreciate everybody being here today. And basically what we're looking for is I've got a couple of esteemed members of the health field here to all try and send the same message to the governor and the Iowa General Assembly that we would like them to accept the Medicaid expansion that the federal government has offered them under the Affordable Care Act. So I think that's pretty much the intro at this point. I'll let Cheryl go first. As we indicated, Cheryl's introduced herself, but she's a pediatrics nurse practitioner, child advocate, health advocate here in the area for many years, and very respected statewide. So with that, Cheryl Jones.
Thanks, Steve. Well, I think most Iowans know, but last year the Supreme Court decision gave states flexibility in terms of how they might address health care for the poor, which gave them the option to expand Medicaid or not, depending on how they wanted to do it. But Medicaid expansion would involve providing health care services to those up to 138% of poverty. And in this area of the state, that's a significant number of our population. So it's very important for areas like ours. It's been estimated that in Iowa this would serve 150,000 Iowans. And the important thing too is it offers basic health care to these individuals, and that includes mental health and substance abuse. And these are very important benefits that these individuals need. The federal government has offered to pay 100% of the cost for these new enrollees for the first 3 years. And then after 2020, the states would pay 10%. Now there is a proposal. Well, the Senate has passed legislation which would expand Medicaid basically as this describes, and it now goes to the House. The governor has a proposal also, an alternative proposal. The concerns about this one, though, is it does not cover mental health in his proposal. That would be coming under another proposal, Medicaid expansion. And Steve might speak more to this, but it appears from what I've read that this would put some significant costs on the counties. It's a 60-40 match, 60% federal, 40% state. But my understanding is if the Medicaid, if the mental health part goes in, the counties would have to do that match for the against the federal, which could be a problem. Also, this proposal does not include substance abuse coverage, which is significant. So from the standpoint of looking at the needs of Iowa citizens and the needs of individuals in this part of the state, would strongly encourage the legislature and the governor to expand Medicaid, given that option that we have, to address the health needs of our citizens in this part of the state, which is extremely important.
Okay. Thank you, Cheryl. Next we have Rick Johnson, who is the CEO of River Hills Community Health Center, and he was also Director of Wapello County Human Services for many years, so Rick's well educated and grounded in this whole area. So with that, Rick Johnson.
Okay, thank you very much. I would like to kind of piggyback on what Cheryl had said. I think it's really important that Iowa go ahead and accept the full Medicaid expansion over the next 3 years so that 150,000 Iowans do have adequate health care. In the governor's proposal to go ahead and instead of doing the Medicaid expansion, his idea would be to keep the Iowa Cares program with a few enhancements. The problem with the Iowa Cares program is there's a lot of things that aren't currently covered under the Iowa Cares program, such as medications, lab, and x-ray. And in our 8-county service area that River Hills serves, that means that 2 of our counties, Mahaska and Monroe County, already have to go to Broadlawns Hospital in Des Moines, and our other 6 counties still have to go to University Hospitals in Iowa City. So there continues to be a real access problem by people having to rely on the Iowa Cares program because there's not access all across the state where they can go to get that service. And like Cheryl said, it's an issue because the governor's proposal does not include mental health coverage, which is a huge limitation in our service area. We used to have 4 psychiatrists here 3 years ago. Now we have no local psychiatrist at all anymore in Ottumwa. So mental health issues are a huge piece of what people need to be able to access for quality health care. The other thing is, if Iowa would go ahead and approve the full Medicaid expansion, it would also dovetail nicely with Governor Branstad's goal of having Iowa be one of the healthiest nations in the state, or in the country, actually. And so I know he's concerned about, with the budget cuts that are going on at the federal level now, I think there's a concern on his part and other people, especially in the Republican Party, that the federal government will not live up to their 3-year commitment of funding the program in its entirety. When I was in Washington, D.C. last week and we did Hill visits in Washington, we got pretty much resounding support that, you know, if the states do go ahead and commit to Medicaid expansion, the federal government has to go ahead and continue to fund that fully for 3 years. But I know that's the governor's concern, is will the federal government, you know, fully fund it for those first 3 years that the program is up and running. I really hope that that will happen. Without full Medicaid, people cannot access quality health care, and there's going to be a lot of vulnerable people. We don't currently serve as an Iowa Cares provider, but 3 years ago we had about 3,800 patients in our 8-county service area that rely on going to Broadlawns or Iowa City for the Iowa Cares program. So this would really have a very significant impact in our service area that we serve. There'd be between 3,500 and at least 4,000 Iowans just in our 8 counties alone that would be eligible for this full-blown Medicaid expansion. That right now they rely on a very antiquated, very limited Medicaid coverage under the Iowa Care program.
Thank you, Rick. I really agree with everything that the prior 2 speakers said, but I wanted to flesh this out a little more. We're talking about 150,000 Iowans, and probably about 80,000 of them are getting the Iowa Cares program now, which, as Rick and Cheryl explained, is, while an improvement over what we had in the past, it replaced state papers. Certainly not a full-blown health coverage program for folks. This would be a complete medical coverage for people. And who are these people? Well, the vast majority of them are workers, are employed. These are people who are home health workers, work at Walmart, work at convenience stores, grocery stores, full-time, don't have benefits. And this is probably the only way that they're going to be able to get full medical coverage. If you compare the 2 plans side by side, Medicaid expansion's 150,000 people with full health coverage. The governor's plan is 89,000 people with not full coverage. The cost, Senator Hatch spoke about this the other night on the floor. Over the next 7 years, Medicaid expansion would be free to the state for the first 3 years, and then we'd pay 10% after that. And they figure that'd be roughly $167 million, which is the cost of 1 year of the governor's plan. And if you take it over 7 years, the governor's plan would cost 7 times as much to Iowa taxpayers. Doesn't seem very fiscally prudent to me. So we pay a lot more and get a lot less for fewer people. I don't really see the advantage of this. Now, we talk about the governor's plan, and we've been talking about it here today, but we really don't know what the governor's plan is. He announced last July, 9 months ago, that he could not go along with Medicaid expansion, and he was going to develop an Iowa program. Well, all we've seen was about 2 weeks ago a 3-page layout on it. We really don't know what this plan is, what it would cover, how it would be paid for. We do know that it would require 60% of the money would come from the federal government. So it was kind of amusing to me to watch the Republican senators get up the other night and talk about, oh, we can't trust the feds, they're going to let us down, they're not going to pay this money. Well, in fact, they've always covered Medicaid, they've never let us down on Medicaid. And if they're going to let us down on this, aren't they going to let us down on the governor's plan too? It makes no sense. The governor's had at least 9 months to plan this. As pointed out, he might have been waiting till the election to see if President Obama lost and maybe this would all go away, but that didn't happen. So the election was November 8th. It's now almost April. Where's the plan? several of the Republican senators wanted us to wait for the governor's plan. Well, the final deadline's by the end of the week. This bill's got to move, and it did. The senators passed it. This is something we desperately need statewide. We really need it in this area. So we're strongly encouraging the governor and all the legislators to pass this. There's really no good reason not to, and it would help a lot of people tremendously. Questions from any of you folks, for any of us?
Do you feel like confident that it will pass?
No. It's got to pass the Senate, which it did. Then it's got to pass the House, which is Republican majority, and then the governor's got to sign it or get 2/3 to override a veto. I don't, at this point, see any of those scenarios happening unless something changes. Now, the Iowa Cares program disappears at the end of the year.
At the end of 2013.
It's done at the end of this year. The legislature ended that program.
So once that happens, then
There's nothing.
There's nothing, something has to replace it. And if the House passes a bill of its own and the Senate has theirs, then it goes to conference committee if they have two separate bills. And that's one of the scenarios that's been talked about is going to conference committee. But you know, it's very unsure, certain what's going to happen here. The reality is there's a lot of Iowans that need health care that at this point in time don't have access to it. And the reality for the legislature and the governor is we need a health care plan for those citizens in the state. In my view, Medicaid expansion is the most realistic and makes the most sense. But the bottom line is there are Iowans who are, quite frankly, very much at the mercy, if you will, of what happens in the legislature. They can't make the decision, and their ability to afford health care is already, I mean, it's a problem. If they could afford it, they'd have it, and they can't. So, but I agree with Steve. I think right now it's just real uncertain how things are going to go. But it's very important for our citizens.
I did want to expand a little bit on something that Cheryl had mentioned too about mental health. As you know, the state's done this mental health reform, which we weren't too excited about, but they did it. And it's largely funded by state and county dollars, and they were counting on Medicaid expansion to really make this work. So if we don't do Medicaid expansion, it ain't gonna work. And the governor's program would take $44 million of county property tax dollars around the state and go into his plan. That's $44 million less we'd have for mental health. And of course, his plan, at least what we know about it, does not cover mental health. So that's really going to put a crimp in the county's ability to do that. And it was also noted the other night that Polk County would be required under the governor's plan to put $42 million into that, into the governor's plan. So he's relying on county property taxpayers to fund a lot of this too, which would just take money away from other things. I'm sorry, Chelsea, you were about to say something.
What I was gonna ask how this possible plan, either or, whichever one passes, how it would pair with the new mental health reform and how either would affect our area.
Well, like I said, they were planning Medicaid expansion to put it together to cover a lot of the holes and bring the money necessary to really make it work. If we don't do the Medicaid expansion, it's really going to put an even bigger crimp in the mental health reform.
And we're our area of the state is so much poorer.
Yeah, these two southern tiers of counties in the southeast part of Iowa has always been the poverty belt of Iowa.
Yes, very high need. So quite frankly, could be even more impacted, negatively impacted, depending on how this all comes out. Both the patients who need this and also the ability, as providers in the area, how do we deal with this if these folks don't have access?
It really leaves them like in an uncertainty, it seems
very
like.
very much so. It leaves all of us kind of in limbo.
Several of the Republican legislators have spoken too about why we're going to add all these people to the system, but we're not adding more doctors and nurses and nurse practitioners, so how's it gonna work? Well, that is gonna be a problem in the short run, but I don't think that's a reason not to give people health care. You know, that will force the system to produce more providers. But that's certainly not a legitimate reason to not give people health care.
The other thing too is if Governor Branstad really wants Iowa to be one of the healthiest states in the country, one of the easiest ways to do that is to provide total access for people to get quality health care, and the Iowa Cares program really does not provide good access for folks who need primary health care. You know, transportation is a huge barrier for folks in our part of the state, even to get to Iowa City or Des Moines. And you know, if they were full-blown Medicaid patients, then obviously they could get their primary care in their own home community. And that's a real important thing for a lot of our folks. They don't have the additional resources to get themselves to certain places in the state that are approved for the Iowa Cares program. And you know, that's a big piece from where I sit, is that the Iowa Medicaid expansion program would really take that whole access issue off of the table for all of our people who live down here in southeast Iowa.
Anything else? Again, thank you for coming, appreciate it.
Thank you.
Yeah, thank you.
Very important issue.
Largely been the part of the legislature and their ability, their willingness to cover these kids. But what I see is the parents don't have coverage. And so you've got children who can get access to care, and I got parents who have significant health issues, and then trying to get care for them because they aren't eligible under the current Medicaid rules. So Medicaid expansion would allow for these, the parents of these kids. I mean, I worry about the parents of the kids as much as I do about the kids.
Yeah.
But we have done an incredibly good job in Iowa of covering our children. Now we need to do an incredibly good job in Iowa of covering our adults also.
Because if you don't have healthy adults to take care of the kids,
Right.
that's only half of the equation.
That's exactly right, Rick. That's exactly right.
The other thing too is, you know, the Iowa Cares program, even though, you know, it did serve a purpose, there's just so many things that it doesn't cover, and then when people have to go to just certain locations in the state to access care, it just really causes access issues for everybody. And that's why I guess I'm somewhat surprised that the governor is being resistive to the full-blown Iowa Medicaid expansion, because it really dovetails in with his goal of having Iowa be one of the healthiest states in the nation. And you can't be a healthy state if your citizens don't have access to quality health care.
We could speculate on why the governor doesn't want to do this, but I don't know that that's productive. I think what we really need to look at is this has to happen.
Right.
And the alternative that he's presented is not a substitute, and would cost more and deliver less to fewer people.
I mean, part of the problem with the Iowa Cares program, to be frank about it, is we've had patients who have been diagnosed with cancer and other serious illnesses, and then they might wait 6 or 9 months before they can actually be seen by a specialist at University Hospitals in Iowa City. So not only is it an access issue for patients to get in initially, it also can be a very lengthy time that they are delayed from even getting specialty care to deal with whatever their diagnosis is. So that's pretty significant when you have people that have cancer diagnoses or heart diagnoses, and they're waiting anywhere from 6 to 9 months to be able to access a specialist to treat them for that condition. And those kind of things are going on right now with the Iowa Cares program.
So Iowa Cares does not cover mental health services or substance abuse.
Or dental.
Or
dental.
Or prescription
Or
drugs.
prescription drugs.
Or x-ray or lab.
Or transportation to
Yes.
Iowa City or Des Moines.
So-
It's a very limited Medicaid waiver program is what it was.
Yeah. For example, if you are an Iowa Cares patient and you have a problem and you go to the Ottumwa hospital,
They cannot
they
treat
cannot,
you.
they have to triage
Well,
you.
but they're
But
not
they
an
will
approved
not-
Iowa Cares
They will not
provider.
get paid. You don't get paid anything for seeing those. And if the patient has to be seen in Iowa City, if it's emergent or anything has to be transported, it does not pay the transportation. It does not pay the ambulance charge. I
Which
know
would be significant.
Representative
Yeah.
Hansen was telling me about one of his constituents in Fairfield who had to be transported and had a several $1,000 ambulance bill, which you would well get.
And they're closer to Fairfield.
And they're closer than we
to
are.
our city than we are.
But the reality is, you aren't supposed to treat them because you're not in, like, they could come to Rick here at the Community Health Center, get a lot of care, but Rick can't see them because he's not in that network. So it's quite a complicated system. And you have to see them if they come in to be sure that they don't,
Right.
that they're stable.
Right.
But you can't be reimbursed for that, and then you have to transfer them, and then if they
Right.
don't have transportation, that doesn't pay for transportation. It was a stopgap system.
Right.
And it certainly leaves a lot of holes.
When was that put in place?
5, 6 years
About
ago.
5 or 6 years ago.
Before that, we had what they called
State
state
papers.
papers, where each county
Yeah, the
had
CHIP
so
program.
many, I think we had about 50 some. That we could have 50 some residents go to Iowa City and get free health care. And that was complete health care.
Well, for hospitalization.
Yeah, but it was only for 50 people.
Right.
So they took that money and some Medicaid money and created this Iowa Cares, which was an improvement, but not adequate. And now it's really not adequate. And you have this other alternative, which costs the state nothing. It's already paid for feds have budgeted for it. If we don't take it,
Another
other
state will
states
get
will
our
get our
money.
money.
Yeah. And the other thing that we found out too, like Cheryl said, is we're not an approved Iowa Cares provider, but because the transportation can be such an issue for patients, we've ended up treating some of those Iowa Cares patients, and they go on our sliding fee scale, and we treat them as a sliding fee patient, which is unfortunate because normally they've got limited health insurance that they should be able to use and not cost them anything, but because of the distance and other things as far as access issues, we'll go ahead and take them as a private pay patient and put them on a sliding fee scale, and then they have to pay for. And sometimes they don't have the means to even pay for their co-pays.
They would have to pay out of pocket then,
Right.
because you can't.
In order to access the service locally through us, that's the only way we can take care of them.
And
because we're not an approved vendor.
138% of poverty for a single person was 15,000 and something, and for a family of 4, 32,000.
Doesn't, yeah.
So you can see a lot of people are going to fit in that who are
Especially
working.
in our part of the
In our
state.
side of the state, yes. It's certainly not, these are not people that can go out and buy private insurance.
No.
And they have a lot of chronic care.
Yes.
They have a lot of chronic conditions. I mean, these are not, some of these people are really heavy duty. They need quality health care. They have like several diagnoses.
And part of it is because one of the realities for individuals who do not have good health care coverage, they tend to put stuff off. Oh, well, maybe in a week or two it'll be better. And by the time they do come in, things can be very problematic. And then it's much more expensive, and they're much
Yeah.
sicker. And when they could have come in to see Rick's people, months ago, and they said, oh, we've got some issues here, let's get started on some things, and maybe warded off some of these big things. So, it's not everything. It's access, it's really an insurance
Yeah.
program. You still have to have access to quality providers, and certainly there is the issue of, recruiting providers. But if you don't have access, if you don't have an insurance card, you're really locked out of the
Shut out,
system.
yeah.
They really are.
Yeah, one of the centers the other night was comparing it to somebody who was having numbness and tingling in their feet and going to see a doctor under Medicaid. They could do that. If without it, we'd probably have to wait till they had gangrene and they went to the emergency room and had a foot or leg removed. And that's what we're talking about.
It's important stuff, and quite frankly, we need to make the appropriate decision on what's in the best interest of the citizens of the state.
Right.
My opinion is Medicaid expansion.
There are 5 community health centers in Iowa that were approved as approved sites for Iowa Cares. They were going to initially try and do it with all 14 community health centers in Iowa, but as it turned out, they ended up going with 5 community health centers, and they're the ones on the western side of the state and across the northern part of the state, and then Broadlands in Iowa City. So there's really like 7 locations in the state that you can go to access this program, which is pretty limited when you think about the state of Iowa as a whole, and there's only 7 locations that you can go to access. There's 99 counties. That's a long way for a lot of folks to drive.
Who don't have the resources to buy
To
the
get there.
gas to get there.
Yeah, it really is.
All right. Well, thank you very
Thank you.
much.